Anxiety. Sometimes just the word itself is enough to induce it. It's also one of those things that can be so hard to explain coherently. Though some degrees of anxiety in life is perfectly normal, like before a big test in school or going on a first date, for some people it can completely take over and make once easy tasks very difficult. Anxiety can even permeate every aspect of a person's life and result in physical symptoms like lack of sleep, elevated blood pressure, or weight gain. In fact, anxiety can become so extreme that it's been classified as a mental health disorder, or rather, it has become an umbrella term for several different disorders, such as generalized anxiety disorder, post-traumatic stress disorder, also known as PTSD, social anxiety, panic disorder, separation anxiety, specific phobias, and obsessive-compulsive disorder. These conditions are all characterized by an inability to function due to excessive nervousness, worry, fear, apprehension, and restlessness. Do you suffer from any of those? You're not alone. If we're to trust statistics, anxiety disorder is prevalent. According to diagnostic interview data via the National Comorbidity Study Replication, anxiety affects 40 million people in the United States, and 31% of the people experience some form of it at some point in their lives, with women experiencing it more often than men. Is this video making you even more anxious? Sorry about that. I'll stop with the gloom and focus on things that you can do to combat anxiety instead. Now, it's important to note that treating severe anxiety may require a combination of medical intervention and psychotherapy, so be sure to speak to your doctor first. On the other hand, anxiety symptoms can also benefit from lifestyle changes, including natural stress management, exercising, following a proper diet, relaxation techniques, and various natural supplements. And that's what we'll focus on in this video. The 11 study-backed supplements to help manage anxiety and panic attacks. First up is a supplement that's become super popular in the West as of late, ashwagandha. Sometimes called Indian ginseng, this adaptogen has been used for centuries in Ayurvedic medicine. Adaptogens are herbs that help mitigate the effects of stress and anxiety in the body. To evaluate ashwagandha's impact, a 2012 study tested it out on 64 people with chronic stress and anxiety. The researchers first measured cortisol levels and measured subjects' stress levels. Then, for the duration of 60 days, the subjects received either 300 milligrams of ashwagandha twice a day or a placebo. Those who were given ashwagandha reported a significant reduction in stress compared to the placebo group. Even cortisol levels, an indication of stress levels, were lowered. So, how much ashwagandha do you need? The recommended dose of ashwagandha for stress and anxiety management is 600 to 900 milligrams a day. This is usually divided into 2 doses. The most potent ashwagandha is made solely from the roots of the plant. The leaves, which are sometimes included, may dilute the efficacy and do not contain as much of the active ingredient called withanolides. On that note, look for a product that contains at least 2 to 5% of this ingredient. Next up is Ltheanine. It can commonly be found in green tea and is the reason a cup of tea can be so relaxing. This amino acid increases the production of alpha brainwaves, which has been linked to a feeling of alert relaxation. In 2011, a study evaluated the effects of Ltheanine on anxiety symptoms of patients with schizophrenia. On a daily basis, for a duration of 8 weeks, 60 patients were given either 400 milligrams of Ltheanine or a placebo. During the study, they were evaluated using various psychological scales for various markers, including anxiety, general functioning, side effects, and quality of life. Those who received Ltheanine supplementation were found to have a significant reduction of anxiety and general psychopathology during the study period. Researchers concluded that Ltheanine may be a safe and viable option for treating anxiety in people with other psychiatric conditions. So, how much Ltheanine do you need? Well, there are no official guidelines regarding recommended daily intakes. That being said, most supplements contain around 200 milligrams. Next up are B-complex vitamins. Sometimes referred to as B-stress complex, these supplements are a combo of 8 B vitamins: thiamine, riboflavin, niacin, pantothenic acid, B6, biotin, folic acid, and B12. All of which play a role in maintaining a healthy nervous system, helping you stay calm. A 2012 study evaluated the impact of B-complex supplements on symptoms of depression and anxiety in 60 adults. Subjects were first given the Beck Depression and Anxiety Inventory, 2 self-report scales to assess symptoms, and were then given either a B-complex supplement or a placebo for 60 days. Those who received the B-complex demonstrated significant improvements on the depression and anxiety scale. They also reported increased vitality, well-being, and improved social functioning. So, how much B-complex do you need? Most supplemental dosages of vitamin B-complex range from 300 to 500 milligrams per day. B vitamins are also widely found in many foods, so a balanced diet, including lean protein, whole grains, and green vegetables, will also provide adequate amounts. Next up, we have vitamin D, a fat-soluble vitamin that our bodies can make on their own from sun exposure. As you've probably been told many times in your life, vitamin D helps maintain strong bones by helping with calcium absorption. But did you know that this vitamin has also been found to help maintain a healthy weight, boost immune function, and play a role in managing depression and anxiety? In fact, a 2015 study found that people with anxiety tend to also have lower levels of vitamin D. At this time, however, there have not been any studies which have found vitamin D supplementing to successfully treat anxiety, only that there is a connection between low levels and anxiety symptoms. Further research is certainly needed to solidify the hypotheses that vitamin D is a viable or effective anxiety treatment option. We'll keep our eyes open for new research on the matter. So, how much vitamin D do you need? Because vitamin D is not readily found in many common foods, typically you'll find it in small quantities in foods such as fatty fish and fortified milk. Vitamin D supplements can be a good alternative. The recommended daily allowance for vitamin D is 400 international units for most adults. But the best way to know exactly how much vitamin D you need is to have a blood test. If your levels are severely low, your doctor may prescribe a high-dose supplement for a few months to normalize your levels. When choosing between options, it's recommended to go with vitamin D3, as it is better used by the body than vitamin D2. Number 5 on our list is magnesium, commonly found in whole grains and green leafy vegetables. It's frequently called the relaxation mineral, as it is critical for muscle and nerve function. It also helps maintain healthy blood pressure and a normal heart rate. A poor quality diet typically means not getting enough magnesium. Too much stress, alcohol, and coffee can also deplete magnesium, making deficiency worse. In turn, a deficiency in magnesium can increase anxiety and lead to difficulty with relaxation. A 2012 animal study found that magnesium deficiency caused anxiety symptoms and HPA axis dysregulation. The HPA axis is responsible for how our nervous system reacts. Another study conducted in 2008 found a connection between diets low in magnesium and an increase in depression and anxiety. As always, we welcome and prefer more human studies on the matter. So, how much magnesium do you need? The upper limit for magnesium supplements is 350 milligrams per day, so aim to stay under that. Supplemental magnesium causes water to rush into your digestive tract, which can lead to diarrhea. This is great for those who struggle with constipation, but not so much for those who do not, so keep that in mind. Magnesium can also be absorbed through the skin without the digestive side effects. For anxiety management, consider an Epsom salt bath or a magnesium lotion before bed to promote a restful night's sleep. Next up on our list, we have an item that's both a neurotransmitter and an amino acid, GABA, or gamma-amino-butyric acid. Has been called a natural Valium due to its therapeutic ability to reduce stress, anxiety, and promote a good night's sleep. In fact, people with anxiety are more likely to have low levels of GABA. There isn't enough conclusive evidence just yet to know if GABA supplements might be an effective treatment for anxiety, but a 2016 study did find that taking the herb kava kava helped increase GABA receptors in the brain and helped manage anxiety. This suggests the solution may not be taking GABA supplements directly, but taking other nutrients to help increase GABA. As mentioned, however, more conclusive evidence is needed to say for certain. What is apparent is that when GABA is increased in the brain, relaxation kicks in. And some healthy ways to go about boosting GABA include yoga, meditation, and exercise. So, how much GABA do you need? Dosages used in clinical trials vary from 3 to 5 grams a day, but it is not clear if this is in fact an ideal dosage. Most supplements come in 500 to 750 milligram doses, and for anxiety symptoms recommend starting with 250 milligrams 3 times per day. Because research on GABA supplements is preliminary at this time, it's best to consult with your doctor. Next up is a rather difficult to pronounce neurotransmitter by the name of 5-hydroxytryptophan. Thankfully, just 5-HTP for short. 5-HTP is required to make the so-called feel-good hormone, serotonin. In fact, the body is actually able to make 5-HTP on its own from the amino acid tryptophan, but sometimes has trouble converting it all the way to serotonin. The research on the effectiveness of using 5-HTP for balancing serotonin levels is mixed and limited. Some studies claim that supplements can help significantly improve symptoms, but frequently these studies use 5-HTP with other treatments or medications, making it hard to figure out what exactly is improving the symptoms. But some animal studies are promising, showing that 5-HTP can decrease symptoms of anxiety. We're hoping for more conclusive human-oriented research in the near future. So, how much 5-HTP do you need? Supplement dosages range from 100 to 300 milligrams per day, usually divided up into 100 milligrams 3 times a day. That said, even though in the short term 5-HTP may help relieve anxiety symptoms, the safety of 5-HTP has not been measured long term. There is some concern that taking 5-HTP for an extended period can deplete other neurotransmitters like dopamine and epinephrine. As always, speak with your doctor beforehand. Next up is one of my personal favorites, chamomile. It is widely known for its medicinal properties and ability to promote relaxation and healing. There are 2 main types of chamomile, German and Roman. Its overall benefits come from plant compounds called terpenoids and flavonoids. These are antioxidants that lower oxidative stress, which can negatively impact the brain. A 2016 study evaluated the effects of chamomile on 179 patients with generalized anxiety disorder. For 38 weeks, participants were given 1,500 milligrams of chamomile or a placebo. Those who received the chamomile supplement experienced significantly fewer anxiety symptoms, lost weight, and had an overall lower blood pressure during the study period. So, how much of it do you need? The supplement form usually contains 300 to 500 milligrams of chamomile, or you can enjoy it in its tea form as part of a relaxing pre-bedtime routine. Valerian is a well-known herb that promotes sleep and relaxation. It may also be an effective treatment for anxiety. How does valerian fight anxiety? A 2015 study evaluated the effects of valerian root on a stressful procedure called hysterosalpinography. 64 women who were undergoing the procedure were given 1,500 milligrams of valerian or a placebo 90 minutes before undergoing the procedure. Those who received the supplement reported significantly less anxiety during the procedure than those who got the placebo. Although the anxiety in this study was acute and related to a specific stressful event, valerian may be useful for managing more generalized anxiety as well. How to take valerian? The average dose of valerian is around 500 milligrams. Long-term evidence of its safety is lacking, but no major harmful side effects have been reported either. It is probably best not to take valerian for more than a few weeks at a time. Side effects may include drowsiness, dizziness, and headaches. Consider taking it in the evening at home so you know how you will react. Next up, we have another herb used for its medicinal properties for centuries. I'm talking about the adaptogen Rhodiola rosea, and it is thought to help decrease stress, relieve symptoms of depression, and improve fatigue. It may also help improve exercise performance. A 2015 study evaluated the impact of rhodiola on anxiety, stress, and other mood-related symptoms. 80 participants were given either 200 milligrams of rhodiola twice a day or no treatment. After 14 days, subjects reported a significant reduction in anxiety, anger, stress, depression, and confusion. One can see why this herb has been around for centuries. So, how much rhodiola do you need? Dosages and supplements range from 100 to 700 milligrams daily. It can be found in either capsule, liquid, or tea forms. We bring our list to an end with one of the most powerful antioxidants in the body, glutathione. It helps lower inflammation and neutralize oxidative stress, and its antioxidant power indicates that it may be able to decrease the risk of multiple chronic diseases. Low levels of glutathione has been linked to an increased risk of anxiety and depression, because oxidative stress is extremely damaging to the brain and can impact its functioning. Yet surprisingly, glutathione supplements haven't been demonstrated effective in raising glutathione levels in the body because it is broken down into other amino acids during digestion. However, several other supplements may increase glutathione levels naturally. These other options include selenium, curcumin, vitamin C and vitamin E, N-acetylcysteine, and milk thistle. Food-wise, green leafy vegetables, garlic, and meat may also increase glutathione. So how much of it do you need? Recommended daily dose of glutathione ranges anywhere from 50 milligrams to 600 milligrams per day. We recommend talking to your doctor before settling on a dosage or starting intake. And that tops off our list of the best supplements for anxiety, symptoms of which may come and go, depending on what is going on in your life. However, if your anxiety is impacting your relationship and your ability to function, you may want to seek medical treatment. Severe anxiety disorders usually need professional treatment by a therapist, psychiatrist, or medical doctor. So as always, please speak with your doctor before making major adjustments to your diet and/or lifestyle. Some of these supplements may interact with other medications you may be taking, and some may bring about side effects not mentioned in this video. Lastly, please help control our anxiety levels by hitting like, subscribe, and the notification button below.